Welcome and thank you for joining me. My name is Solandia Petrolio and I'm Health Educator for Community Health at Atlantic Health System. Today, the webinar, The ABC of Diabetes, is presented by Angelica Cardenas, Master in Public Health and Chess, Health Educator for Community Health Department at Overlook Medical Center. Before we begin, I have a few announcements. All participants are muted. Please use the Q&A button for questions of the chat or button of comments. Contact us at communityhealth at atlantichealth.org or call us.
Right. Thank you. Hello, everyone, and welcome. Thank you for joining me today, joining Sol and I today for the presentation titled The ABCs of Diabetes, a Brief Overview. My name is Angelica Cardenas, and I am a certified health education specialist with the Department of Community Health here at Atlantic Health Systems, based out of Overlook. All right. Before we begin, it is important for us to say that the content of this presentation is not intended to replace the medical advice of your care team. As a health educator and as health educators, we can provide information that's basic knowledge to help increase awareness and provide you with available resources. But of course, we cannot answer questions related to your clinical diagnoses, any follow-up or treatment that you may need. Your primary care provider is best equipped to tailor recommendations and advice specific to your health needs and your health status. Okay. First, I want to share what I hope you'll gain from attending today's program by sharing these learning objectives. So I'm hoping that by the end of the program, you'll be able to list at least 3 parts of the body that are impacted by diabetes, that you'll be able to recall 2 ways diabetes can be managed, identify at least 4 of the letters that and what they stand for in terms of diabetes management, and state at least 2 recommendations that are related to screenings and exams for those diagnosed with diabetes. Again, what we cover today is not intended to replace medical advice from your care team. We won't be discussing specific diagnoses of diabetes, nor its clinical management using medications or more. If you do have those questions, we would be happy to direct you to additional resources at the end of this program. All right, so to start off, let's do a quick refresh on what diabetes is. Diabetes is a chronic condition that affects how your body uses food, or glucose. The food you eat is broken down and converted into glucose, also known as sugar, and it goes into your bloodstream to be transported around your body. When your blood sugar goes up, your pancreas is signaled to release insulin, which is a hormone that allows sugar to be used as energy. So you can think of the pancreas as an organ that makes a key, insulin, that helps glucose enter your cells. So what is diabetes then? Diabetes occurs when insulin is not being produced properly by your body, or when the body doesn't produce enough insulin, or when the body is not using insulin properly. When that happens, glucose can't enter your cells to be used as energy, and there ends up being too much sugar or too much glucose in your bloodstream. Over time, too much sugar in your bloodstream can cause serious health problems such as heart disease, vision loss, kidney disease, and we'll be discussing some of those complications as we move on in the program. More importantly, we're going to be talking about ways to prevent those complications by managing your diabetes. Okay. So now that we know a little bit of what diabetes is, I want to make sure we talk about the 3 main types of diabetes you may have heard about. Type 1 diabetes is when the body does not produce insulin at all. Type 1 is thought to be caused by an autoimmune reaction, which means that your body is attacking itself by mistake. Those symptoms tend to develop very quickly, and type 1 diabetes is often diagnosed in young people and adolescents. Type 1 diabetes makes up about 5 to 10% of all diabetic cases. And currently, we don't know exactly how to prevent type 1 diabetes, but we do know that having a family history of type 1 diabetes, meaning a parent or a sibling with type 1 diabetes, is a risk factor. Next is type 2 diabetes, which is the most common form of diabetes and accounts for 90 to 95% of diabetes cases. And this is when the body doesn't use insulin properly or doesn't produce enough insulin. Type 2 diabetes is typically diagnosed in adults, but it can be seen in children and teens as well. And it tends to develop over time. And some people may or may not report having symptoms prior to being diagnosed. While some people can control their blood sugar levels with healthy eating and exercise, other people may need medication or insulin to help manage it. Regardless, there are options, and we will talk about those options today. Knowing that type 2 diabetes can be prevented or delayed with healthy lifestyle changes and modifications, such as eating healthy and being active, is also important. Finally, those of you who have ever been pregnant may have heard about gestational diabetes, which is diabetes that develops during pregnancy in people who already did not have diabetes. 2 to 10% of pregnant people in the US will be affected by gestational diabetes, and it typically doesn't have any symptoms. Gestational diabetes can happen because during pregnancy, the body makes a lot of hormones and is going through a lot of other changes like weight gain, which can lead to insulin resistance. Especially in the later portion of pregnancy. So many people report that their blood sugar returns to normal after pregnancy. However, having had gestational diabetes does put someone at greater risk for developing type 2 diabetes later in life. In fact, about 50% of people with gestational diabetes will go on to develop type 2 diabetes. And finally, some of you may have heard of pre-diabetes, which is when it comes to pre-diabetes, the blood and sugar levels are higher than normal, but not quite high enough to be considered type 2 diabetes yet. 1 in 3 people in the US have pre-diabetes, and more than 80% of people don't know that they have it yet. And that's often because there aren't clear symptoms, and it develops over time. So people who develop type 2 diabetes often have pre-diabetes, they just don't know it. So it's important to talk to your doctor about getting your blood sugar tested if you do have some risk factors. While there's no cure for diabetes, that doesn't have to stop us from living a healthy life. You can manage this condition and reduce the risk of developing complications. Diabetes management includes healthy eating, physical activity, medications if prescribed by your doctor, and managing the blood sugar levels regularly. The management also includes remembering the ABCs of diabetes, which is the title of this presentation today. These are the things that are going to help you prevent those complications of diabetes. So before we go on, I want us to do an activity, and I would like to know what you all think the ABCs of diabetes stands for. So when I say ABCs of diabetes, I'm referring to several key diabetes management topics. The letters of the alphabet that I'm going to share on the next slide are intended to help you remember the important topics to manage your diabetes. And don't worry, we're not going to use the whole alphabet. So let's do a brainstorm, and I hope that you can use the chat to enter what you think the letters on the next screen stand for. All right, so here are the letters representing what we'll discuss today. Feel free to tell me what you think some of these letters stand for in the chat. You don't have to name them all, but if you think you know 1 or 2 of them, please enter them in the chat. Now I'll take a look at the chat to see what you all are thinking. So what could A, B, C stand for? Oh, so it's saying that the chat is disabled. Okay, well, it looks like the question and answer box is working. So if you want to enter your thoughts in the Q&A, that's okay too, because I can see that. Okay,
So
thanks,
let
Anne
me
Marie.
see. Yeah, so let me see now if their chat is working now.
Think so.
Okay,
In the
okay.
meantime, I'm seeing some answers. So Anne Marie, activity, good guess. Christine, A1C, blood glucose level, and great, good thoughts. Other thoughts? The other letters, E, K, M. A1C or appetite awareness, carrot, nice, great. Cholesterol, yes. Okay, awesome. Well, thank you for participating. Great job, everyone. I like what you're thinking about. Thank you, thank you. Kidneys, yep. E for education, I like that. F is for foods you consume. Nice. Okay. Great job, everyone. All right. Thank you for participating. And let's move on to our first letter. All right. We're gonna move on to so here are the answers, if you will. A is for A1C, so you all guessed that. B is for blood pressure. C, cholesterol or cardiovascular health. E, eyes. F, feet. K, kidneys. M, medical team. O, oral health. S, smoking cessation. And V for vaccination. All right, let's move on to that first letter. So A is for A1C. All right. So you've heard of an A1C test, also known as hemoglobin A1C or abbreviated as HbA1c. This is a blood test that's going to measure your average blood glucose level over a 3-month period. So when sugar enters your bloodstream, it's going to attach to hemoglobin, which is a protein in your red blood cells that carries oxygen. Everyone has some sugar attached to their hemoglobin, but people with high blood sugar levels have more. The image in the top right is an example of a red blood cell with sugars attached to it. The A1C is going to measure the percentage of your red blood cells that have sugar-coated hemoglobin. So an A1C test measures the average blood sugar level over a 3-month period because red blood cells live for about 3 months. Nerve damage is one possible complication from having high blood sugar levels for a long time. High blood sugar damages your nerves, and these nerves may stop sending messages to different parts of your body. Nerve damage can cause several different health problems, ranging from mild numbness to pain that makes it really hard to do normal activities. Half of people with diabetes have some nerve damage. The good news is that for most people, you can prevent or delay complications by keeping your blood sugars as close to your target levels as possible. So when you do this, you'll have more energy and you'll feel better. Your goal may be different depending on your particular health status, but most medical professionals will set a goal of an A1C of less than 7%. If you have diabetes, it's recommended that you get an A1C test twice a year, unless you have changes to any medication. In that case, you might have to get it more often. In any event, you should definitely talk to your doctor about how often is right for you. Good daily blood glucose control is going to mean an improved A1C over time. So the A1C is an important tool for managing diabetes, but it does not replace blood sugar testing at home. Blood sugar goes up and down throughout the day and night, which is not captured by the A1C. Because remember, the A1C is measuring an average blood sugar level over a 3-month period. So the best way to manage your A1C and prevent complications is to maintain or manage blood sugar levels or lower your blood sugar with lifestyle modifications or medications if they are prescribed to you. Some of those lifestyle modifications may include being physically active, because physical activity makes your body more sensitive to insulin and it helps control blood sugar levels and lowers your cardiovascular risk. It's recommended that a good goal is to have about 150 minutes per week of exercise. Make sure that you do check your blood sugar before you're physically active, especially if you're someone who takes insulin. If your blood sugar is too low or too high, it is not recommended that you exercise. However, you should check your glucose after activity just to have an idea of how activity impacts your glucose levels. It's going to be important also to check your feet after you're doing some physical activity, because any injuries of the foot after an activity may go unnoticed for folks who are having some of that numbness already and can't see or notice or feel the injury to their foot. If you do notice an injury and notice that it's not healing after 2 days, you should definitely call your doctor. All right, so the next modification to our lifestyle would be eating a balanced diet. For some people, that may include counting carbs or carbohydrates. That can help match your activity level to the medicines that you eat. Remember, there are 3 types of carbs: sugars, starches, fibers. When we say sugar, we mean the sugar that's in natural sugar that's in fruits, for example, or milk. And we mean the added sugars in sodas, for example, or packaged foods. Starches are going to include the wheat, the oats, grains, starchy vegetables like corn and potatoes, dried beans like lentils or peas. And then the fiber is the part of the plant food that isn't digested but does help you stay healthy. Carb counting is a tool that some patients use to maintain a balanced diet. Not everyone uses it, but if it's something you are interested in, it'd be important to speak with a dietitian, a certified diabetes educator, for recommendations on how to go about doing that. And there are staff at all of our medical centers who are trained to provide this service, and it's covered by some insurances. Lastly, it's important to avoid excess alcohol consumption. Alcohol, especially when combined with certain diabetes medications, can lower your blood sugar or cause hypoglycemia. And so the general limits for alcohol are no more than 1 drink for females or no more than 2 drinks for males per day. All right, our next letter is B for blood pressure. Blood pressure is the amount of force that your blood is using to get through your arteries as your heart contracts and relaxes. The blood is carried from your heart to your body and then returned, right? It's circulating throughout your body. Blood pressure is measured in 2 numbers. The number on top is the systolic pressure, and that is the pressure when your heart is contracting and pushing the blood through your body. And the bottom number is your diastolic pressure, and that's the pressure in your arteries when your heart is at rest. So blood pressure rises and falls throughout the day, and it is individual to you. It can be impacted by different activities. It can be impacted by medications or consuming caffeine, for example. So it's important to know that high blood pressure is often a silent disease, and there are often no symptoms associated with high blood pressure. Really, the only way to know how your blood pressure is doing is by measuring it. As I said, your blood pressure is unique to you, and that means that the management is also unique to you. So blood pressure goals are going to vary depending on an individual's risk and any other health conditions they may have. The general recommendation for those with diabetes is a blood pressure of less than 120/80, and the goal for those without diabetes is 120/80, and the goal for those living with diabetes is a blood pressure of 140/90 or less. If someone has other risk factors that put their heart health at risk, the goal is likely to be lower. And the best way to reach your blood pressure goals is, again, we're going to keep coming back to this, lifestyle modifications that include healthy diet, reducing dietary sodium intake. If lifestyle modifications alone don't help, of course, there are medications for management of blood pressure that may be recommended to you. For medication questions, or if you think that you may need medications, please contact your primary care team. If you have high blood pressure and diabetes, it can increase your risk for, or what we'll cover in our next letter, which is C for cardiovascular disease. So if you have diabetes, you're twice as likely to have heart disease or stroke than someone who doesn't have diabetes and at a younger age, unfortunately. So coronary artery disease is the most common type of heart disease, and it's caused by the buildup of plaque in the walls of the coronary arteries, the blood vessels that are supplying oxygen and blood to the heart. A buildup of plaque and potentially a blockage in the vessels leading to the heart can lead to heart attack. If the blockage happens in the vessels leading to the brain, it results in a stroke. And if it happens in the vessels to the limbs, this can cause peripheral vascular disease. For all these reasons, it's important to have your cholesterol checked regularly or as recommended by your healthcare team. Typically when you go to the to see your healthcare provider, you will get checked for cholesterol, and the test, which is also called a lipid panel or a lipid profile, is usually going to check your levels of cholesterol and triglycerides. So specifically, you should be getting results related to your LDL, your low density lipoprotein. Sometimes it's called bad cholesterol. Some people remember it as lousy. So bad cholesterol, lousy LDL. Having high levels of LDL can lead to plaque buildup in your arteries and result in heart disease or stroke. Then you'll also see results on your high density lipoprotein, so your good cholesterol, or H for healthy. This good type of cholesterol can lower your risk for heart disease and stroke. So you want to aim for improving that number of your HDL. You'll also get results on your triglycerides, which are a type of fat in your blood that your body uses for energy. And lastly, you'll get results on your total cholesterol, so the amount of cholesterol in your blood based on your HDL, LDL, and your triglycerides. The best way to manage cholesterol is, again, lifestyle modifications, such as eating a balanced diet, primarily made up of lean proteins, more fruit, more vegetables, reduce saturated fats, trans fats, and cholesterol intake. You should also limit processed foods because they often contain those fats and sugars that we don't want, aiming to reduce saturated fat and cholesterol intake and other trans fats. Again, if you're not exercising, we recommend that you start slowly and incorporate more physical activity into your day. Again, aiming for at least 150 minutes of physical activity per week. And if lifestyle modifications alone aren't helping, your medical team may recommend medications to help lower your cholesterol. If medications are required or recommended due to not having improvement with lifestyle modifications, the medications that they recommend will depend on your medical history and any other health risks that you may have. All right, our next letter is E. E is for eyes. Managing diabetes is important to protect eye health. Diabetic retinopathy is a common eye disease and is a leading cause of blindness in working age adults. The condition is caused by high blood sugar damaging the blood vessels to the retina, and it usually affects both eyes. Damaged vessels can swell and leak. That's what causes the blurry vision or stop the blood flow to the eye. Other eye diseases that can affect people with diabetes are cataracts, glaucoma, macular edema, and you can protect your vision and lower your chances of vision by doing a few things. Of course, getting an eye exam, specifically getting a dilated eye exam at least once a year so that your eye doctor can spot any problems early. That's when they're the most treatable. Also important to keep your blood sugar levels in your target range as much as possible, because over time, high blood sugar not only damages blood vessels in your eyes, but it can also affect the shape of your lenses and make your vision blurry. You can also keep your blood pressure and cholesterol levels in your target range to lower eye disease and vision loss. Of course, it's good for your health in general. If you're a smoker, quitting smoking will be key to preserving your eye health and being active. F is for feet. Feet are an important and thing to keep in mind because often we take our feet for granted, and like we mentioned earlier, there may be some numbness or some loss in sensation that you may start to feel due to your diabetes, and it's important to check your feet. So foot care for those people with diabetes is important because diabetes is the #1 cause for non-traumatic extremity amputations. So there are two types of amputations. One is traumatic, which is an amputation due to a major injury, such as a car accident, for example, and non-traumatic, which are from planned surgeries because of disease complications. So as I mentioned earlier, when blood sugar is high for a really long time, it can damage the vessels and nerves to the limbs, leading to peripheral artery disease, which can result in decrease or loss in sensation. And that's significant because a loss in sensation can increase your risk of unintentional injury or an injury that goes unnoticed and therefore untreated. The best way to manage your foot health is to achieve your blood sugar goals, to get an annual foot exam with your clinician. They check your feet for sensation and look for any injuries that are not healing appropriately. It's also important to check your feet at home daily. And here are some good tips for taking care of your feet at home. They recommend washing but not soaking, but not soaking, and drying your feet very carefully after you've washed your feet, especially between the toes, and avoiding putting lotion between your toes. Any corns or calluses should be treated medically by a podiatrist. You should use shoes or slippers that have a rubber or non-slip sole. They don't recommend you wear flip-flops and use socks that are of a breathable fabric. Ideally, you should be using white socks, and that's again because you may have a loss of sensation. And if you're wearing white socks and you have an injury, you're likely to notice the injury because you'll see blood on the white sock. So that's a helpful tip. A helpful way to do a foot self-check is to utilize a small mirror like the one pictured here. You should be looking for any cuts, scrapes, or any other kind of change to your feet. For those who may have difficulty cleaning your feet, a soft loofah or a long brush may be helpful when you take a bath. Definitely ask your podiatrist or your medical team if you're okay to have pedicures because of the soaking risk. Also, those with diabetes are often going to need to have their toenails trimmed by a podiatrist, and that's just to reduce the risk of unintentional injuries caused by any cuts. So depending on your current health status, they can provide recommendations for foot care. All people who get pedicures should make sure that the location that you go to uses new tools for each client, or they're clean between guests, or even that they use disposable tub liners if you are going to get your feet soaked. All right, our next letter is K. K is for kidneys. Your kidneys help to remove waste product from your body, but over time, high blood sugar can damage the blood vessels that support your kidneys. High blood pressure can also damage the kidneys by straining those blood vessels. Chronic kidney disease, or CKD, occurs in 20 to 40% of people with diabetes, and approximately 1 to 3 adults with diabetes has CKD. It does take a long time to develop, and it often has no symptoms in its early stages. The best prevention method for keeping your kidneys healthy are meeting your glucose levels and your A1C levels, meeting your blood pressure goals, and eating a healthy diet that is low in sodium and being physically active. You should also get an annual kidney screening. The annual screening assesses your any kidney damage via a urine test and assesses kidney function via a blood test. M is for medical team. It's important to stress that those with diabetes be seen by their medical team regularly, and depending on your unique needs and situation, the team might include the following: a primary care physician, an endocrinologist, an ophthalmologist, podiatrist, dentist, cardiology or cardiologist, nephrology, and a certified diabetes educator or a registered dietitian. O is for oral health. Good oral health habits can prevent pain and infection from tooth and gum disease. Gum disease can be more severe and take longer to heal if you have diabetes. If you have gum disease, your diabetes may be harder to manage. Here's a quick look at how diabetes can take a toll on your oral health. You may have less saliva, causing your mouth to feel dry. Dry mouth is also caused by medications. Your gums may become inflamed and bleed often, and those are signs of gum disease. Infection in your mouth can take longer to heal. The best way to care for your oral health when you have diabetes is to maintain your target blood glucose levels and have good oral hygiene. The recommendation is that you see your dentist at least 2 times per year for professional cleaning, for x-rays, and for a general checkup. And that if you have gum disease, you treat gum disease because that can help lower your blood sugar over time. Other key steps to keep your mouth healthy include brushing your teeth twice a day with a fluoride toothpaste, flossing at least once per day, examining your gums regularly. If they're swollen, if they bleed easily, or if you notice that they're red, please see your dentist. Also, again, those regular dental visits. And if you are a smoker, consider quitting smoking, because smoking increases your risk of gum disease and can worsen your diabetes. That brings us to our next letter, which is S for smoking cessation. Smoking is a major cause of cardiovascular disease, and for those with diabetes, your risk of medical issues increase if you are a smoker. Smoking contributes to 1 in every 4 deaths from cardiovascular disease. Smoking can narrow and irritate the lining of your blood vessels by damaging the cells that line the blood vessels. It raises your triglyceride levels. It lowers your good cholesterol. It also makes your blood sticky and more likely to clot, which can block flow to the heart, cause a heart attack, or cause a stroke. It can also increase that buildup of plaque, like fat, cholesterol, and calcium, and it can cause thickening and narrowing of your blood vessels. If you are a smoker, there are resources to help you quit. Atlantic Health System has a free quit smoking program that includes an assessment and free nicotine replacement products while you're enrolled in a 6-week quit smoking program. There are also many options located throughout New Jersey and nationally, and there are dedicated quit centers that you may find in your area. There's also the Quit Line, And we can provide you with a list of resources at the end of the program if you're interested in that. Our final letter is V. V is for vaccine or vaccinate. Diabetes, even if it's well managed, can make it harder for your immune system to fight infections. So you may be at risk for more serious complications from an illness compared to someone who does not have diabetes. Adults need to keep up their vaccinations because immunity from childhood vaccines can wear off over time. You're also at risk for different diseases as an adult, and vaccination is one of the most convenient and safest ways to or preventive measures that you can take. Some of the typically recommended vaccines are the flu vaccine. It's been noted that the flu can raise your blood glucose to dangerously high levels. So annual flu vaccine is important if you have diabetes, especially important if you have diabetes. The other vaccine would be the shingles vaccine for those who are over 50 and over. The Tdap, tetanus, diphtheria, and pertussis vaccine is recommended every 10 years and as a booster. The pneumococcal vaccine, which is recommended for those 65 and older, or for those younger than 65 if they have certain high risk conditions like asthma, heart, or lung disease. And lastly, the COVID vaccine. There may be other vaccinations recommended to you based on your lifestyle, your travel habits, or other factors. So please speak to your medical team about what other vaccines might be helpful to you, depending on your lifestyle. Right. In summary, diabetes can impact multiple systems. We've seen that it can impact systems from your head to your toes. Good maintenance and lifestyle behaviors can reduce the risk of complications or premature death. It's really important to know your numbers and remember those ABCs. So focusing on your daily glucose levels, your A1C, your blood pressure, your cholesterol. And it's important to go for those regular care and recommended screenings. If you don't have a care team, it's important to start with your primary care practitioner who can connect you with all the different specialists that we mentioned in an earlier slide, if that is what you need. Here is some information on our services in the outpatient diabetes centers. We have a diabetes center located at each of the medical centers. These centers offer medical care, diabetes education classes, as well as diabetes support groups.
We appreciate your joining us today, and we kindly ask you take a few minutes after today's webinar to complete the program survey. The link to the survey has also been added to the chat for your convenience. And a special thank you, Angelica, for dedicating your time and expertise today. If you have additional questions or comments, send an email to communityhealth@atlantichealth.org or call us at 1-844-472-8499. Option 3. That concludes our webinar, and we'll say again, thank you to you, Angelica, and thank you, everyone.